Hi everybody. I'm going to go over some DFD interview hints and tips for your communication station. I know that most of you have got interviews coming up in the next few days, and I just thought I'd do a quick video so that I could give you some hints and tips from my own experience. Firstly, please don't be nervous. Because when you're nervous, it shows in your body posture and it shows in your face. So be very relaxed, dress up smart, a nice suit, clean shirt, look professional. When you go in to see your actor patient, make sure you greet them nicely and introduce yourself, and also ask them about their name and date of birth to confirm that they are the actual patient. After you've done that, you need to then ask them a few questions. Now, I've had a quick scan through your scenarios, and majority of these patients have actually been seen by another dentist, and then you've been asked to see them. So you still need to go a little bit through like the initial history taking, but you don't have to really engage too much in that. So for instance, you ask them about their complaint. You make sure that you say that you're really sorry to hear, for instance, that their tooth is broken, or they have had pain and discomfort. They're really sorry if their denture is broken and this is the third time that it's broken, and show a bit of empathy and sympathy towards this. Also, please just go quickly through their medical history. Just say that I have your medical history sheet here, and I can see from your medical history sheet that you are fit and well and you don't have any allergies. Is that right? So hopefully they will nod their head and they'll say yes. Also, make sure that you ask them quickly about smoking and stuff like that. Majority of them is written here that they're non-smokers or smokers. So just say that I see that you smoke 10 a day or you drink alcohol. So go through that a little bit as well, but don't engage on it too much. You literally have 10 minutes and you don't want to waste your time on that, because you want to come up with your diagnosis and treatment planning. Also, I want you to definitely again say I'm really sorry to hear that you've been in pain and you are actually suffering from this broken tooth, but you're going to do your very best to help them out. Ask them a little bit about when the tooth broke. So for instance, the person who had the fractured incisal tip, the medial incisal tip of the upper left one, just ask them, say that, how did it break? Ask them if they lost consciousness, if they had to go to the hospital, and also see if they found a little bit of the fragment or not. Then after you've done all your questioning, you could maybe ask them a little bit about the diet. It'd be relevant with the child who's got the caries on the lower D's. That'd be very relevant, because a 4-year-old with caries is probably more diet dependent. So question more about that. With the denture, you could question how did it fracture? How did the denture fracture? And also, were they eating anything hard, etc. So you can question a little bit about that. So till now, you've probably spent about 3 minutes just discussing that. Now you need to get to the nitty-gritty. So say that now I'm going to quickly take you back and I'm going to do a quick examination of your mouth, if that's okay. I do understand my colleague has done that, but I just want to do a few quick tests. So for instance, for the upper left one, you might want to do some vitality testing, sensibility testing, to see how the reaction of the pulp is. And you could quickly explain, say I'm going to do 2 tests. One is an electric pulp tester, one is a vitality testing using a cold cotton wool. Is that okay? And then you quickly do the test, and then you sit the patient up and you just say that, you pretend to be sitting the patient up, and you just say that, based upon my judgment and my clinical judgment, and also the radiograph, which you can see here. I can see, for instance, the upper left one, your tooth. Can you see this black line, that's your nerve. I can see the root is intact, there's no infection. So, based upon your x-ray and based upon what I've seen in your mouth, based upon the test, I'm going to come up with a diagnosis, and my diagnosis is whatever the diagnosis is. Okay, so you make a quick diagnosis. Now, don't use too much jargon. So if, say, for instance, upper left one is pulpitic, whether reversible pulpitis, then don't sort of say pulpitis, say that I can see that your nerve in your tooth is slightly inflamed, but it could be reversible, the inflammation, but sometimes trauma cases can become irreversible, the inflammation, and then you may need root canal. So my diagnosis at the moment is reversible inflammation of your nerve, and say that I'll probably want to I would probably dress the nerve with some nerve dressing or with some calcium hydroxide or biodentine, and then I'm going to put a filling over it, and I'm going to reassess you. So make sure you always say you're going to follow your patient up in every single case, okay? And sometimes you could also say, if there's something the patient's asking you about and you're not sure, say that I'm going to ask a senior dentist in the practice to come and sort of have a look and give their opinion as well. So based upon all the tests you do in the mouth, now don't forget that you have to check mobility, TTP, tender to percussion, make sure you check your BPs, and show the x-ray to the patient. In some instances, you can take photos of the teeth. So say that I'd like to take a quick photo for my clinical records, and say based upon all this, I'm going to come up with a diagnosis. Now, by now, it should have hit about 6-7 minutes. So you literally have 3 minutes to wrap up your interview and make sure that you've covered everything. So you've come up with your diagnosis. Now quickly come up with prognosis of what whichever case you're working on, and also then after that make sure that you come up with a treatment plan, which you've said that I'm going to either pulp cap with calcium hydroxide, follow up in a week. If you develop a lot of symptoms during this week, then please come back to us. We're always here to help you, and you may need root canal treatment after that. But say because the nerve seems intact and the root on the x-ray seems intact, then I've made the decision to pulp cap it for now, but tell them about the signs of trauma which could happen, like discoloration of the tooth over time or developing an abscess over time. And then ask the patient if they have any questions, if anything's not clear, and if the patient says I'm fine, say so this is the fee under the NHS, and these are the forms you need to sign. I'm going to do the work for you. If in the case of the denture case, just make sure that you show a lot of empathy, maybe even say that I'm going to speak to my supervisor to see, or my senior dentist to see if it's possible at all to waive the fee for repair this time for you, and then just go through all the different reasons why a denture might break, because it's opposing natural teeth. So if a denture opposes natural teeth, then a full denture then that is producing stress in the denture, so that could be a reason. The other reasons could be the denture is 6 years old. There's been bone resorption. You could explain that to the patient. Say, you do get bone resorption after you lose your teeth because the function of the bone goes, and you could get bone resorption. So then the denture will rock. So one of the other ways maybe to secure this fracture, if you don't want a new denture, maybe it could be a reline. Okay, and say that maybe we could offer you a reline, and that might help, or maybe a denture with a stronger acrylic, a reinforced acrylic, or a metal plate denture. You could then metal palate denture. So you could then expand a bit on that, because obviously the denture is broken in half, then you need to make an immediate treatment plan there and then, because you can't send the patient without teeth. So maybe you'd want to chair side, put it together, because it says both parts of the denture come together properly. So maybe chair side, you want to put them together, and then maybe do a reline impression for him chair side. So you say that I will discuss it with my senior dentist, see if this is possible, and say that, or I might speak to my technician to see if how fast within a day they can repair it for you. And then in the meanwhile, I'll go through the fees for your other options, and the other options could also long term be implants, retained dentures. So the other thing with the tooth with the upper, I think it was upper left 6 fractured buccal wall, explain to the patient, say, I'm really sorry this has happened, how did it happen, were you eating something hard, it broke, and then say that, I'm really sorry that this has happened, and I will do my best to help you, because this patient is somebody else's patient, so maybe this treatment you can just offer them some emergency treatment. Now the GIC is intact inside the tooth, so maybe just by removing the buccal wall, your patient will be comfortable, and that would be it. And probably because they're a patient of someone else in the practice, you don't want to charge them. So you're doing it as gesture of goodwill. So you could explain that, as gesture of goodwill, I will not charge you, I'll just take this wall off. But because they've recently had an x-ray done, because they're in the middle of root canal, maybe you don't want to radiate them again. So you could or you couldn't. It depends on your judgment. But maybe taking a photo of the actual fractured buccal wall would be a good idea, because then the dentist who's on holiday, when they come back, you could show it to them and say this is how the fracture was, and then they could come up with a treatment plan. Now the treatment plan for this case depends on how bad the fracture is. If the fracture is really subgingival and below the crestal bone, then probably the prognosis could be poor. So you could explain to the patient the prognosis is probably poor. If the patient is really insistent that they want to save it, then maybe you could offer them maybe crown lengthening. Now, how you can measure where your fracture is, if you haven't got an X-ray is not the best way anyway. You could use a Williams probe, which is the probe you use for 6-point pocket charts. So you could use that to see how far the fracture line's gone, and in that way you could then assess to see if this tooth is restorable or not. With the lower D's case, that's a little bit more prevention in my opinion. So really, a 4-year-old having caries on the lower D's at this early stage is quite early. So maybe you'd want to discuss prevention and DBOH toolkit, toothbrush supervision by parents, filling a diet sheet, warning them that the patient will need fissure sealants as they get older. Also ask them if the child's been breastfed for a long period of time. The child is over age of 4, so you could probably do Durafat varnish as well. This child has got mesial caries, but the marginal ridge is intact, so maybe you could just take, without LA, go into the cavity and just clean it, or maybe put a little bit of a resin in there, or you could use Hall technique, which is the stainless steel crowns, but you need to explain, because not all parents are willing for their children to have stainless steel crowns. Now, so this is more based around prevention. Make sure you mention diet sheets, very important. Make sure you, if the child's not in the room, apparently the child is probably there but not inside the room, so maybe you could bring the child in and do a bit of tell, show, do, and prepare the child for the next following appointment, because this child's never had a filling. So then you could speak to them and just prepare the child and get the child ready for the following appointment. You could also here mention NICE guidelines, etc. for recall period. Now, in all these cases, most of your cases, the patient has been a smoker, so maybe it's worth mentioning smoking cessation advice, giving them, and also just making sure that they're aware that smoking can cause mouth cancer, so speak to them about that. Just in summary, make sure you greet your patient, make sure you check that your patient is the patient, so check their name, their details, date of birth, quickly go over medical history with them, just make sure that they know that you're checking your medical history, and the diet quickly. As I said, that should literally take 3 minutes. Then you go into examination. On the pulpitic case, with the hypersensitivity, you do need to mention the vitality sensibility testing, TTP, mobility, BPE, that you're checking all that. Obviously, you don't have to explain everything in detail to the patient. There's just no time. But as long as the examiner is aware that you are actually aware of these things that you have to do on your patient, then the examiner will be happy with that. So you don't have to explain, I'm going to use a probe which is like this to measure your gum, it might hurt, just say that, is it okay if I use a probe to measure? Is it okay if I did a test on your teeth? Yeah. And then sometimes the actor might actually go at a tangent and sort of, they say, oh, I've had another root canal on this tooth and that tooth and whatever. Then what will happen is that you will divert from your from what you're trying to do. So just say to the patient that, say, oh, yes, I understand you have other issues, but please let me just sort your tooth out, get you out of pain, and then I will then obviously address your other issues in due time. In some of them, you have to mention your DBOH toolkit, delivering better oral health toolkit, your NICE guidelines, things like that, and in this station. So I think I've covered everything which I thought. Please also mention consent. So if you're doing photos, make sure you take consent. So just by asking them, are you okay? And say, I'm going to take a written consent as well. Make sure that you mention fees, but you don't have to go into detail. Say, this is the NHS fees. Are you happy with that? If you're stuck, say that I'm going to ask a senior dentist to give you an opinion, which would be your supervisor. And also always remember, the patients come to you in pain, so they don't want to leave with pain. So you're going to sort them out. So tell them, I'm going to do my very best to help you. I'm going to do my very best to get you out of pain. And just keep saying that you're really sorry that they're in pain, really sorry that the tooth is broken, really sorry that the denture snapped in half twice. Okay, and then you can, as part of the denture you could also have an option of putting maybe a mesh in, reinforcing the fracture site, and you could say that I'm going to personally speak to a technician and see what else they can do to make the repair last longer, but also explain long term probably is better if you do invest in a new denture and maybe a metal palate or implant retained overdenture. The other thing is definitely show your x-rays to the patient, say that based upon the x-ray I can see this and this and this is happening, and anything else, bone resorption, palatine raphe, all those can play a part because bone resorption can cause a flabby ridge, so that could make your denture unstable and then lead to a fracture. So it's been like rocking, like a seesaw. And also, obviously they've had it for a long time, haven't they? I hope all this helped. If you have any questions, you can always message me on Instagram on Dental Cosmetics with double S at the end. I'll be happy to help you. Anything else about your other station? It's all based upon GDC guidelines, your compliance, your clinical governance, and procedures and protocols in the practice. So make sure you know your GDC 9 pillars. Make sure that you know about HTM 0105, which is a decontamination guideline, which came out in 2013. Make sure you know a bit about your disability acts, child protection and vulnerable adults, and also make sure that you know a little bit about things in HTML 105, so the decontamination process and things that we need, like our flow of from dirty to clean, the autoclaves, washer disinfectors. Obviously, CQC is very important. It's got key lines of inquiries, which are based on safe, effective, responsive, well-led. And these key lines are quite important. So please learn the 5 key lines of CQC. Safety is not just safety of what you do. Is you have to be safe, your staff have to be safe, your premises have to be safe. So obviously, staff is important. Their immunization, vaccination. They have to have DBS. They have to make sure that they have all their CPDs and they're up to date with their knowledge. Make sure that all the dentists are up to date with their knowledge and they have all their primary things required in their staff folders. And also your safety of your premises is important, so make sure that your electric testing, the pad testing is done, your services of your compressors, your chairs, everything is up to date, your IRMA is in place, your radiation protection is in place, and everybody is following the protocols correctly. So that would cover safety. Well-led is when there's the practice is providing appraisals for staff, the practice is providing all your training, practice meetings, and everything's being discussed, like MHRA is discussed in practice meetings. Make sure that you're aware about COSH, you're aware of REDOR, and that these are just things which are around caustic substances. So COSH is a folder where all your the material we use in the practice is all in that. So say for instance, if we're using etch and the etch splashed in somebody's eye, then we look in the COSH folder, we find out what to do, how to wash the eye with saline and clean it, and to prevent any further injuries. And also make sure the practice has to be compliant with IRMA 2018, and that's just means that for any device we have in the practice, health safety executive has to be has to know about this. We have to make sure that we are compliant, and that every X-ray unit has been tested, and we've got test pack for it. We should have local rules. We should have a radiation advisor and a radiation supervisor. Radiation advisor is someone outside the practice, and our PBC, I think there's one, there's DBG, there's various people who do that for us in our practices, and the supervisor is normally the senior dentist or the practice principal who's the supervisor. The other things which makes a practice safe is if you've got backup in the practice. So majority of practices are now computerized, so they need to have backup for patients' files. Now, if you don't have that, your practice is not compliant. You need which normally is done on discs, and the discs are taken home. Also, you need to make sure that you have data protection and ICO, and these things are quite important. I think I mentioned DBS. Every dentist and every member of staff who has to have DBS. Vaccinations are quite important. Then responsive and again well-led, effectiveness, all fall into one thing, and doing audits in the practice are very important. So one of the main audits is cross-infection control, which is quite important, which is done 6 monthly and it's done online. The other audits, like X-ray audits, are quite important to be able to quality assure your X-rays. So for instance, if you're taking 200 x-rays a month for argument's sake, then you have to make sure all these x-rays are reported, graded, and justified. And then somebody in the practice could be designated a dentist maybe, or even the dental foundation trainee to do the audit for the x-rays. And then say based upon that audit, you have an action plan. So say, for instance, Nicola Gore has done 20 x-rays in a month, and out of those 20 x-rays, 15 are grade 1, but 5 are grade 3, then you have to come up with an action plan. Why are Nicola Gore's x-rays five of them are grade 3? And then I have to probably get extra training on why am I not using a holder or what's happening. Okay, so that is those are audits. The other audits, patient satisfaction surveys are important. NHS does send friends and family to the practices, so that is done, and patients would fill that and put that in a box. A medical history taking, a record keeping audit. So these audits are quite important to do in the practice, just to make sure your practice is working well. So those the quality assurance for your practice. The other things are, that you're not supposed to disclose any information about your patient to anybody. So even on social media, there's strict rules now. So without patient's consent, you're not posting anything about the patient on social media. So that's quite important. And it's called confidentiality. And this is a big issue, and you have to make sure even if staff are leaving messages about patients' appointments and confirming them. So don't leave a message to say you've got an appointment tomorrow, because anyone could be picking that up. And if the wife doesn't want the husband to know, or the husband doesn't want the wife to know, then that's going to create issues for your practice. So confidentiality is a big thing. Don't talk about your patients outside the practice. You mustn't disclose any information about any family member to anyone unless they're underage and they've come with their parents. And that takes me to Gillick competency. So if you see patients who are 15, 16 over, and they come without parents, then you need to make a judgment whether they're Gillick competent or not. And that there is a little grid which you could go through that with them to find out if they're Gillick competent or not. And if they are Gillick competent, then maybe you could actually do work on them. If you felt they're not, then you shouldn't do any work, and you should then ask their parent to come in with them. If you're not sure, then you're always asking your supervisor. Now, if something has a problem in the practice, you always go to your educational supervisor. If your educational supervisor can't deal with it, then you go to your TPD for that. You guys all know that there's a DFT portfolio which you will have to fill. On that DFT portfolio, there's reflections of the week. You fill in that. There's other things like ADEPS. There's other things such as DOPS. And these are when your educational supervisor observes you to see how you doing each procedure. And then there's bits about tutorial, about reflection of study days, etc. that you fill in. I think I've given you as much information as I can remember, but please, if you are worried about anything, I know it's last minute, but just send me a DM and I'll try and help you out. And good luck with everything, guys. Keep calm, sleep well, sleep early, so you have a calm head. Just think of it as if it's in a natural setting and it's not in an exam and you're not being interviewed. Just try and be as natural as you can, and so that you don't forget anything. Use your template properly. So have a template in your head, which would say exam, for instance, or consultation, complaining of, history of present complaint, their medical history, their quickly dental history, diet, social history, smoker, alcohol, what job do they have, and then also because the job they have could relate to the stress they may have. So that again could maybe cause of fracturing of the teeth because they grind their teeth. And then you go through soft tissue, intraoral examination of the soft tissues, if there's any white lesions or anything, hard tissues, of their teeth, which tooth is fractured, mobility, TTP, make sure you do BPE, recession is quite important, and then also occlusion is very important, how they bite together, and any guidances they have, because when the guidances will determine, say if they've got guiding on the front tooth, then when you put a big filling it could break. Then after that you come up with a risk assessment of their caries, perio, oral cancer and tooth wear, and thereafter you can come up with a diagnosis, prognosis, and then treatment options for the patient, fees, and then your treatment plan. And always before you start doing any work, you take consent, written and verbal, and you make sure your patient has understood before you even touch your patient. I hope it's been helpful, and good luck with all your exams and interviews and everything, and maybe one day we'll all meet. Thank you.